After extraction, if the bleeding is not controlled, the bleeding control measures we should follow in our clinic. Disclaimer, I am not a specialist, I am just making this video from my experience. Correlating with the theory, the list of products we should have in bleeding control in our clinic. The first thing is the mechanical method. Mechanical method, we should use a gauze pack, not a cotton, to give a firm pressure over the extraction socket. Why gauze not cotton? Because cotton has capillary action. I have made a separate video about gauze pack in our clinic practice. Watch the video in the link given in the description. If the bleeding not controlled even after 20 to 30 minutes, the next thing you can use a t-shirt tea bag, because tea bag has tannin in it which helps in clotting the blood. The tea bags also didn't work. The next thing, we have to give a tight closure of the extraction socket with help of gelatin sponge in addition. I am using this type of gelatin sponge 1:1 square, which saves our time, and we can use them directly over the extraction socket. It is also a sterile one. 99% the bleeding will be controlled in the mechanical method. If the mechanical method didn't work, then we have to use the help of chemical method of bleeding control. The first thing I will be using is the hemocoagulase solution, which is butroclot, which will be not available everywhere. You should ask any medical professional to get this product. Since it is a very rare and not available easily for everyone, the easily available the next product is the hemostatic gel, which is nothing but aluminum chloride gel available in the market. It will be available in syringe form, easy to inject into the bleeding site, and if the mild capillary bleeding, the bleeding will definitely stop when we apply this aluminum chloride gel. The aluminum chloride also doesn't help. You can use this adrenaline. You can break this ampoule and soak it in a cotton. Give a firm pressure over the extraction bleeding site. These are the easily available products for chemical method of bleeding control in our clinic. After chemical method of bleeding control, it will expose the active site of bleeding. Then here comes our thermal method of bleeding control. Most of them never have a electrocautery in your practice. Then you can use your ball burnisher or GP condenser, heat them gently and gently place over the active bleeding site. In the meantime, we will be so panicked. We need to get help of our oromaxillofacial consultant immediately. While studying about this for making this video, I found that 37% phosphoric acid helps in gingival bleeding also. Practically, the most leastly charged and highly risk procedure is the extraction. To avoid bleeding complication, take a proper medical history and do this investigation: bleeding time, clotting time, platelet count, blood sugar and prothrombin time. Avoid bleeding complication in your practice. If you ever feel doubted and if you feel the age is above 60, get this medical test done. To avoid bleeding complication, always get your oromaxillofacial consultant immediately, because God will come to rescue us only through the oromaxillofacial consultant if the bleeding never stop. Like, share, subscribe, dear Madness Dentistry.